My name is Bill Cork, and I'm an Assistant Director of Adventist Chaplaincy Ministries for the North American Division. My topic is Preserving Hope, an Introduction to Suicide Prevention. Suicide is a topic we don't like to talk about or hear about. It's uncomfortable. We want to avoid it, but it becomes very real when someone we know or love dies by suicide. I served as both a campus minister in public campus ministry, as well as had 20 years as a chaplain in the United States Army Reserve. That's part-time service. In my first 10 years, starting in 1986, I knew one soldier who died by suicide. I never counseled a soldier who was thinking about suicide during that time. In my last 10 years, however, from 2009 to 2019, suicide prevention became the dominant theme of my ministry. I found myself doing suicide interventions regularly, as well as caring for the loved ones and friends of soldiers who died by suicide. I also became a suicide intervention trainer, and I kept wanting to know more and more and started going to more conferences and finally got to where I am today, working on a Master of Public Health degree, looking at how can we address suicide as the global public health issue that it is. The most important messages that I want you to get from this presentation are, first of all, that there is hope, and that hope is the antidote to suicide, as Sally Spencer Thomas has said. And we are a people of hope as Seventh-day Adventists. Second, you are in a position to help. It doesn't matter. You don't have to have degrees in psychology or a doctor of ministry degree. If you're capable of being a compassionate, listening friend to your friends, neighbors, family members, you are in a position to help. And if you are struggling yourself, realize that seeking help is normal. It's okay. We as Seventh-day Adventists have a holistic health message that includes concern for the body's well-being, for the mind, as well as for our spiritual side as well. Andrews University has the motto, Spiritus Mens Corpus, body, mind, and spirit. So don't be ashamed. Reach out to those resources that are there to help you. Take advantage of the mental health resources in your community. It's a strength, not a weakness, to seek help when you need it. Now, some assumptions before we really get into the material. I assume that in every presentation, there will be some who have lost friends and loved ones to suicide. And there are some who've had thoughts of suicide, even attempted it. Some of you are uncomfortable talking about it, but you're here, and I want to affirm that and acknowledge that and express my appreciation for it. You want to learn, and by learning about suicide and being comfortable talking about it, we become better able to minister to others who are thinking about it. We won't be shocked when they bring it up. We will be ready to listen. The language we use can sometimes be alienating. And so there are some phrases we try to avoid, like commit suicide. That makes it sound like a crime, and indeed, in many places, it remains a crime. But we want to destigmatize it and make it seem a health issue rather than a criminal issue. I'd encourage you to say that somebody died by suicide, or even that they suicided is a proper term. We can talk about people thinking about suicide or people with lived experience of suicide. It's best to avoid language like successful suicide or completed suicide and just talk about people dying by suicide. Suicide affects every age group, but we're shocked when we see headlines like this: lawsuit blamed schools for bullying 8-year-olds suicide. But we have to realize children are susceptible as well as adults. In fact, according to the World Health Organization, suicide is the leading cause of death among those ages 10 to 19 in low and middle income countries. And in high income countries like Europe and North America, it is the second leading cause of death for this age group. In 2015, there were over 4,000 deaths from suicide among those aged 10 to 19 in Europe, mainly among boys. Suicide is a global problem and it's a public health problem. Here's a map showing the difference in death rates, and this is from 2017. And when we talk about death rate, we use the term of so many deaths from suicide per 100,000 people. So you see here the lightest colored nations are those where they have from 0 to 5 suicides per 100,000. And you see where those mainly are. Peru, places in North Africa, in the Middle East, Indonesia. You also see the darker shades, at 50 to 100, really dark blue up in Greenland. And we'd see even higher rates in some parts of Arctic Canada among the Inuit people, some places over 200 per 100,000. And you see some other high places there, Eastern Europe, Russia, Guyana, South Korea, Zimbabwe are countries with higher than average rates of suicide. It is a global problem and a global public health problem. But if we drill down and look at each nation, we're going to see maps like this. This is my country, the United States. And where do we see the highest rates of suicide? In the mountain states, in the western United States, as well as Alaska, West Virginia, on up into the northern New England states, up in the Northeast. And one of the common factors is that people live more spread out. They're more lonely, more distant from other people. And being together, having good community, having good support is one of the protective factors. I asked some friends who've spent many years working in the Middle East, North Africa region, and I asked, what is it that makes them have the lower rates? And why is it that Islam has, among religions, has the lowest rate of suicide? And this is what they pointed to, the greater community and family networks. I spent a year in Kuwait in 2013, and I noticed these very large homes that are built so that the children, the grandchildren, the grandparents, multi-generations can all live together in one place. We don't have that in Western Europe, in the United States, Canada. So these are some things we look for, and you might want to look at your own nation, pull up your public health statistics and maps, and ask yourself, where are the highest rates of suicide, and why? Why are some places higher than others? Gender differences are also something to consider. The global average rate of suicide is 10.6 per 100,000. And it's higher among males than females, 13.5 opposed to 7.7. But if you look at these bar graphs, and they show that in every case, there are more men than women. In Africa, 9.9 males as opposed to 4.8 female. In the Americas, 15 males for 4.6 females. In Europe, 24.7 male to 6.6 female. One of the reasons why, especially here in the Americas, the use of firearms is more often used by men than by women. Women may attempt suicide more often, but they tend to use less lethal means. That's one thing to account for it. Here's a chart from the World Health Organization, close to 800,000 people die by suicide every year. That's one death every 40 seconds. 79% of suicides are in low and middle income countries. Pesticides, hanging, and firearms are the most common methods used globally. In North America, firearms are much higher. In developing countries, especially in agricultural regions, the use of pesticides or hanging are more common. And look at that number in the lower left hand, 55%. There are more deaths from suicide than from war and homicide put together. Why is it that people die by suicide? Why do they think about it? Why do they think that it's an option? And here's a graph from the Centers for Disease Control in the United States, looking at some of the dominant factors. They tend to be relationship issues, personal crises, physical health, job or financial problems, substance use. Many of these involve a sense of loss. Often they're combined. Somebody who has a relationship problem, a crisis, financial problem, all put together. I've known people who are dealing with health issues, and that kept them from working. They lost income, they had high bills, and they felt overwhelmed. Sometimes there is a mental health issue, like depression, but that is not always the case. Most of these factors are true globally as well, and this is affirmed by the World Health Organization, but they add, in addition, experiencing conflict, disaster, violence, abuse, or loss, and a sense of isolation are strongly associated with suicidal behavior. Suicide rates are also high among vulnerable groups who experience discrimination, such as refugees and migrants, indigenous peoples, lesbian, gay, bisexual, transgender persons, and prisoners. By far, the strongest risk factor for suicide is a previous suicide attempt. We also see that suicide runs in some families. Think of the famous author Ernest Hemingway. His dad, himself, daughter, I believe a granddaughter, something like 6 or 7 people who died by suicide in that family alone. As we look at youth, there are some issues that dominate more there than with older adults. Being under persistent stress. So a lot of those things that we talked about might account for that. Acute loss or rejection, bullying, childhood abuse, trauma, social isolation, family violence, or disruption. Think, if you will, of an iceberg. You know how only a small portion of an iceberg is visible above the water, and like 80 to 90% is unseen below the surface. Again, here is US data from 2014. And we see that there were 41,000 people who died by suicide that year. But what's not apparent is how many people thought about it or attempted. 375,530 self-harm injuries were treated in emergency departments that year. There were 1,120,000 suicide attempts, and there were over 9 million people who seriously considered suicide. This is why we need to do more education whenever we do health seminars, in our preaching, in our teaching, through public health agencies in the community, because we don't know how many people are at that moment thinking about suicide as an answer to their problems. You know, the majority of these will think about it and those thoughts will go away. Some will go get help, some won't. But at any given time, there are people who are hurting and feeling hopeless. we need to be there for them. So what can we do? First message, and again, this is a World Health Organization graphic. Suicides are preventable. What are some effective preventive measures? Restricting access to means, making it harder for people to get a hold of medicines and poisons, firearms, and so on. We need to have responsible media reporting. How the media talks about deaths by suicide can influence others to think, hey, this is a possibility, or it could shame them into getting help, and so they don't. Alcohol policies, because alcohol is often a factor. People who are despondent, if they are drinking alcohol or under the influence of drugs, are going to be more likely to act upon those thoughts. Having school-based interventions, dealing with bullying and social isolation, training health workers in early identification and treatment, and doing follow-up care and community support. These are all effective ways to prevent suicide. We also see that a comprehensive approach, bringing together different sectors, the media, the government, civil society, faith-based groups, healthcare, all of these things working together in public health can help reduce suicide. Some nations have a national suicide prevention strategy, but most countries do not. So here's where advocacy at the public policy level is important. What are some warning signs of suicide? Here are some things that you may hear or see, and this is from the National Institutes of Health in the US, but this is consistent with global data. Some people might talk about it, about wanting to die. Oh, they'll be so much better off without me. I won't be a burden anymore. Talking about the shame or the guilt that they feel. They may express feelings, emptiness, hopelessness, having no reason to live, being very sad, anxious, full of rage, unbearable emotional or physical pain. You may see people change their behavior. They might make a plan or research ways to die. And if you go onto the internet, if you Google suicide in any way, it will pop up with suicide helpline numbers. People thinking about suicide may start withdrawing from friends and family members. They might say goodbye. They might give away treasured possessions, their loved pets. They might take risks like driving too fast, eating or sleeping more or less, changes in behavior that are extreme one way or the other, using more drugs or alcohol, making a will, all of these things. I had one young man who was a very sharp soldier, always had his hair cut, his uniform pressed. He showed up one day for our weekend drill. We drilled one weekend a month, and he hadn't shaved, he hadn't cut his hair, he was looking sloppy. And his sergeant came to me and said, something's wrong. Can you talk to him? He is not like this. So be aware of those things that stand out, that show that something is different about this person. So those are some of the risk factors as well as warning signs, but we also need to think about protective factors. What are things that help people go on living when times get difficult, or even if they seem hopeless? Having good coping and problem-solving skills. Because often somebody who's thinking about suicide just has so many things happening that they can't break down and separate the different issues. They need help doing that. Cultural and religious beliefs that discourage suicide and promote life can be helpful. Connections to friends, family, community support, having healthcare providers and mental health providers, counselors that they know they can talk to, having physical and mental health care available in their community, as well as limited access to lethal means. All of these things can help people get through their problems and protect them, even if they have those thoughts of hopelessness and suicide. So, given that, what can we do if we see some of those signs in somebody, or if we see them talking that way? The first is to recognize them and know that something is happening here that we need to talk about. Ask the person, are you thinking about suicide? Now, some people say, oh, well, I can't do that. That'll put the idea into their head. No, it won't. And the person might say, well, why do you think I'd be thinking about suicide? And you can say, well, you're talking about going away. You're giving away your favorite dog, cat. You're talking about pain. And people who talk about these things are often thinking about suicide. So are you thinking about suicide? Now, for some, that can be cathartic because they've been keeping the secret in. They've been struggling with so much pain. They've felt so alone. And now here's somebody that asks them and is willing to listen. And they can feel a sense of relief at that point. Then what you're going to do is say, well, no, why? Why are you thinking about it? And listen for the reasons. Be there as a friend. Listen to them. Don't preach. Don't start telling them all the reasons why they shouldn't. Listen to what's going on in their lives. And they might mention why they haven't. They might say, well, I'm concerned about how some loved ones are going to feel. They might say, oh, I'm concerned about my spiritual state because I'm not sure that this is right. They might talk of hopes that they had that, oh, I'd always wanted to do this. Now I'm not going to be able to. And you can reflect back to them. Okay, I hear you saying that you're feeling hopeless because of these different things. At the same time, I also hear of these things that are reasons for living. You want to ensure them that their safety. How are you thinking about doing it? Do you have firearms here? Can we find somebody that we can leave those with? You were going to use alcohol or pills. Can I take those from you? What are the things that we can do to reduce the risk right then? And connect them with help. Do they have a counselor or a psychiatrist? Do they have family members? With youth, in our youth programs, in our schools, we have to contact the parents. So we may need to take the person if we feel that there's an immediate risk to an emergency room. We can call a crisis hotline. We'll talk about that in a minute. Many nations have national crisis hotlines that you can call. But again, listen, this is some very simple steps. Recognize the sign. Ask specifically, are you thinking about suicide? Listen for the reasons. Reflect back to them what you're hearing. Ensure their safety and connect them with help. Go with them, if at all possible. We have special situations when we talk about schools and pathfinders. And a great resource is by Terry Erbacher, Jonathan Singer, and Scott Poland, called Suicide in Schools, a Practitioner's Guide to Multi-Level Prevention, Assessment, Intervention, and Postvention, published by Routledge in 2015. Postvention, that might be a word new to you. That's what happens after someone has engaged in suicidal behavior or has died by suicide. And I have a URL there, tinyurl.com, suicide-risk-resources. And there, the publisher has put lots of free resources, including risk assessment forms. What this book also does is help you as a youth department, as a school, as an educational department, prepare for a possible crisis. Some special risks to consider, not just the youth, but the adult leaders. Those who are isolated, bullied, those who are LGBTQ. Um, Christian schools can be, and Christian environments can be difficult places for people wrestling with these issues of identity. Is there a history of suicide in the family? Sometimes among youth, you see suicide pacts where people will say, let's do it together. And you can have contagion where after one person has died, other people may as well. And that's exclusively an adolescent phenomenon, the authors say. What do you need to do to be prepared? And here I'm talking especially to youth departments and education departments and schools. But pastors, elders, you should think about this too. Have a crisis plan. When peers say that they're concerned, take those reports seriously. Ask if they're thinking about suicide. Don't take no for an answer. Say, well, we've seen these things. We're concerned because these are signs that people are thinking about suicide. Call the parents, involve the school counselor, pastor, and chaplain. That means chaplains and pastors, you need to go and get special training. I'll give you some resources for that. Know how to assess risk. Anybody who's a pastor, chaplain, school counselor needs to be able to do this. But that also raises a question. Does your school have mental health counselors available? We had at Andrews University a couple of years ago a symposium about youth and mental health issues, and this was one of the things that we raised. Every school should have somebody that they know, the mental health resources that they can call. It would be great if conferences were able to contract with mental health resources so that they can bring them in to do presentations at schools or bring them in when there are issues in churches or schools. Some insurance plans in some countries have an employee assistance program or have mental health support. That may be an option. And if you have somebody, a student like this who is thinking about suicide, you need to supervise them. At summer camp, at boarding schools, give them around-the-clock supervision. And if they're high risk, know in your plan, where would you transport a student for assessment? Now, some training and resources. As I mentioned, many nations have suicide hotlines or texting services. Here are a few. Find out what you have, what's available in your community, and publicize it. Put it in your church bulletin. If you have a web page, put it on that. Sometimes they'll make up cards or rubber wristbands with the number. Get the information out. Get to know the mental health resources in your community. If you're not sure about whether you have a hotline, you can go to this webpage, findahelpline.com. You just type what country you're in there, and it will connect you with helplines in that country. And sometimes you can break it down by district, state, county, whatever. But that's a great step, a great resource for finding out if your country has a suicide hotline. You may have professional organizations and advocacy groups in your community. Two in North America that have lots of resources on their web pages are the American Association of Suicidology and the American Foundation for Suicide Prevention. Go browse around and check those out. Internationally is the counterpart is the International Association for Suicide Prevention. Here are a couple of resources for what we call gatekeeper training. This is the kind of training that Pathfinder leaders, teachers, youth volunteers, Sabbath school teachers, pastors, dormitory deans, resident assistants, hall counselors, whatever, those people that have contact with a number of other people or have that kind of care responsibility should have what we call gatekeeper training. One is from what's called the QPR Institute. That stands for question, persuade, and refer. Now, those are the same steps that we talked about. Question the person, ask them what's going on if they're thinking about suicide, persuade them to go for help, refer them to help. This organization also has trainers who can do an in-person training. They have a 1-hour online version. They have a 6-hour version online for clergy, other versions for people in corrections, firefighters, nurses, doctors, pharmacists, school health professionals, coaches, and so on. For those outside the US and Canada, they have an online instructor certification training. So you can take the course online and be certified as an instructor. And they vary the pricing according to the World Bank zone. So some countries it's going to be much cheaper to get this certification than others. They've translated their materials into a number of languages and will work with you to get the training materials translated into whatever language you need. Another organization is Living Works. They're based in Calgary, Alberta in Canada. And they have a number of programs developed starting with faculty at the University of Calgary. They have online trainings for individuals, for religious leaders, and they've done trainings in over 30 countries around the world. Living Works Start is a 1-hour online interactive training that costs US $27. The faith-based training program that they have is 5 to 6 hours online. In person, they have a half-day training called Safe Talk, and they have a 2-day in-person training called ASSIST, ASIST, Applied Suicide Intervention Skills Training, where you get a lot of practice in asking questions, in going through the steps of an intervention. And I've taught this for a number of years, and the people who go through it all tell me that they feel so much more comfortable. It gives you a roadmap of the kind of questions to ask and how to have conversations with people that you think are thinking about suicide. 2 days in person, you can contact them and find out are there trainers in your country who could come out and do this for you. Another source for useful trainings and crisis intervention is the International Critical Incident Stress Foundation, ICISF.org. And Adventist Community Services uses those courses to help train people in emotional and spiritual care. They use the ICISF courses in crisis intervention, individual, small group, and so on, so that individuals can work with Adventist Community Services and the Red Cross. Many places you can arrange with your conference community services director to have a training at your church. Adventist Community Services also has Pathfinder Honors in crisis response too. Disaster ministries and community crisis intervention. That one's for older youth, grade 10 and above, about age 15, 16 and above. And here's where you could cover some of this material with youth and get them an honor as well. Because often youth are going to go to a peer before they go to an adult. So consider that. Now let's turn to postvention. This is what happens after a suicide attempt or a death by suicide. What do you need to do with your youth group, school, church, or community? These are some things taken from a document called The Pillars of Postvention for Suicide Events by the Florida Youth Suicide Prevention Project team. You need to provide mental health and what we call psychological first aid to the survivors. Engage the community, school, and family in crisis intervention. Help family members with practical matters. Attempt to maintain educational routines at the school. Use it as an opportunity in the school, in the church, in the community for suicide prevention and intervention training. And in your school, you're going to want to have a memorial service. There's lots of emotional responses that people have in the aftermath of any tragedy. Confusion, shock, sadness, helplessness, nervousness, anxiety. They might want to avoid the places or the topic. They make it adversarial, confrontational, be on edge, have a sense of irritation, disgust, anger. They may feel responsible, guilt. They may be emotionally exhausted. The feelings that I've seen most often are anger at the person, anger itself for not recognizing it, feelings of guilt. Why didn't I know? Why wasn't I there? Those are a lot of the emotional baggage that people will be feeling. So what is the preparedness level of your organization? Do you have a crisis response team at your school, at your church, at your hospital, at your other organization? Do you have staff trained in critical incident stress management, suicide intervention, psychological first aid? I'd ask us to have ADRA country directors and facilities. Anybody who's dealing with trauma needs to be sure to have these kinds of safeguards and crisis response teams in place. When I mentioned memorial services, that gets into the idea of rituals that can help in the healing process. Things like prayer vigils, prayer meetings, memorial service, funerals. And in these times, you don't want to dwell on the details of what happened. You want to connect the Word of God with the person's experience and with your experience and speak hope and comfort. We are people of hope. This is the time where we need to bring that strength, those resources to bear. Now, speaking to those of you who are the caregivers, pastors, healthcare workers, counselors, teachers, this is draining work when you're going through this, and especially after an intervention or after a postvention, you feel many of those same symptoms of the trauma. So you need to take care of yourself. All the things that you're telling others about, all those things that you're teaching about stress and telling other people to realize, it's happening to you too. You need to take care of yourself. In crisis situations, take scheduled rest breaks. Don't keep working through them. In the days and weeks following, take time off, get away, eat right, exercise, sleep, hydrotherapy, taking a good warm bath, getting a massage, talking to another chaplain or pastor or behavioral health clinician. Vent your feelings. Tell somebody about your feelings. Grieve, pray, and praise. Self-care is a part of resilience, our ability to get through adversity and recover from it. All those things we recommend as part of a healthy lifestyle contribute to resilience. Creation Life is a program from Advent Health that covers making proper choices, getting rest, care for the environment, physical activity, trust in God, cultivating healthy personal relationships, having a positive outlook, and getting good nutrition. Those are things that you can recognize from those principles of health that Sister White talks about in Ministry of Healing. So far, I've talked about the individual crisis response to a hurting individual or preparation on behalf of institutions. Let's look wider at the community. A public health approach shows that our wellness is not just based on our own attitudes or choices, but on our whole environment. We use the term social determinants of health. As we strengthen these different areas, like our education access and quality, healthcare and the quality of it, our neighborhood, the built environment, things like access to roads, healthcare nearby, pollution, other hazards in the environment, safety, the social and community context, economic stability. As we strengthen these areas, physical and mental health in the community is improved. Our community health promotion programs like Creation Life contribute to this. The work of ADRA especially contributes to this in the countries where it's working. All that we do to improve the lives of people, work for peace, elevate the standing of women, all the things we do to make life worth living are part of this public health approach that leads people to think that they can keep going, that there is help for them, things that help diminish their stress and bring them solutions. Another example in the field of public health is what we call socio-ecological models. We're not individuals, but we're individuals in connection with those people we have relationships with, our family, our community, and the larger society. And so we need approaches to suicide prevention that support individuals and can do interventions when they're in crisis, that can help strengthen the relationships so that they feel supported, that strengthen our community resources, and that provide policy guidance for local and national governments that help transform societal values and priorities. These last couple of things have been, again, from the Centers for Disease Control in the United States. And here's a look at how suicide prevention looks using that community model. Provide financial support to individuals in need, strengthen access to and delivery of care, create protective environments, reduce stigma about seeking help, connect people with their communities, teach coping and problem-solving skills in schools, in churches, in our community programs, prevent future risk using media to describe helping resources and avoid headlines or details that increase risk. And finally, identify and support people at risk. Everyone can learn the warning signs for suicide and how to respond and where to get help. Use our media, use our publications, use our internet and our television and radio programs to help get these messages out. And we're doing that now by including this topic among the health presentations of this General Conference camp meeting. But whenever I preach at a funeral or memorial service of someone who's died by suicide, I come back to what is our blessed hope. I use texts very familiar to us as Seventh-day Adventists. From the book of Hebrews, chapter 2, verses 17 and 18, therefore in all things, Jesus had to be made like his brethren, that he might be a merciful and faithful high priest in things pertaining to God, to make propitiation for the sins of the people. For in that he himself has suffered being tempted, he is able to aid those who are being tempted. Hebrews 4, verses 14 to 16. Seeing then that we have a great high priest who's passed through the heavens, Jesus, the Son of God, let us hold fast our confession. For we do not have a high priest who cannot sympathize with our weaknesses, but was in all points tempted as we are, yet without sin. Let us therefore come boldly to the throne of grace, that we may obtain mercy and find grace to help in time of need. Brother or sister, if you are hopeless, if you don't see ways out of your predicament, you have in Jesus someone who will listen. And I pray that our church, that you may see in our church too, and in your pastors, and in healthcare workers, in your fellow Christians, compassionate brothers and sisters who will minister to you as Jesus does. And if you're concerned about those loved ones who have died, this is a difficult topic. But look at this says. Who are we judged by? Who is the one who's pleading our case before the Father? Someone who knows our struggles, somebody who knows our temptations, somebody who knows exactly everything that we've gone through. And I feel comfortable trusting them to his love and his compassion. The gospel is good news. It gives us hope. It puts us as the church out in the community to bring that hope to a hurting world. May this message of hope be what the world hears from us and what we provide to the world through our program, through our love, through our care. These are the things that we pray. Let us pray. Loving Father, for those who are hurting, we pray that we may be there as loving representatives of your Son, Jesus. For those that we have lost, we trust them to the compassion of our merciful high priest. And we look forward to that blessed hope, the coming of our Lord Jesus Christ, who will end the pain that we suffer and bring us peace and communion with you in that world without end. Amen.